Hello and welcome back to Kule Jako. So if you are not subscribed to the channel, this will be a good chance to press that subscribe button. If you're already subscribed, go ahead and hit that like button. It motivates me to make more videos because I know that many people are watching. It motivates me to talk about more topics because I know that I have an audience to speak to. Either way, I like making these videos when I have the time, so I'll keep making them either way, but it would be really both of you if you would go ahead and subscribe or like and share the video. So in today's video, we're going to be discussing the two areas you can work in as a nurse. The first one being in a hospital setting. It's either you could be doing medical or you could be doing surgical as a nurse in a hospital, or you could be working in the care homes or in some sort of institution that is a private institution that looks after people who are suffering from mental health conditions. So when you are thinking of moving over to the diaspora or to a Western country as a nurse, you have the option. It's either you can work in a hospital or you can work in a mental health institution. So I'm just making this video so that I can help you make that choice a bit easier by having more information from someone who has worked in both areas, and I'll tell you the advantages of either of those, and you'll make an informed decision having heard from someone who's experienced both sectors. So when I moved to the UK, I started off in a hospital working in a surgical kind of clinical setting, and my experience there was really lovely, but for reasons that I'll get into in this video, I chose to move into a mental health institution and work in a care home. So it's either you're working for the NHS right now, or you're back home and you're thinking of moving over to the UK and you're thinking, oh, should I consider working in a mental health institution? Well, this is the video for you. I'm going to explain the pros and cons of working in either of those areas. Okay, so firstly, let's talk about the hospital setting. Let's talk about surgical medical area. Okay, so when you make the choice to leave your homeland to go and work somewhere else, for most of us, the biggest consideration is the remuneration, the money that you'll be getting, because back home the pay for most of us is not so good, and you choose to come over here so that you can make a bit more money and you feel that you can practice to the fullest extent of your abilities, because not only will you be getting a good salary, but also you'll be working with all the tools that you need to perform your duties being availed to you. You won't need to improvise as much as we did when we were back home, because the tools, they are there and you are able to work to the fullest of your abilities. And also here, everything, most things, in my experience at least, is according to merit. So if you're a good nurse, you can rise in the ranks just based on your abilities. Okay, so how do you choose what area to work in? So for me, when I was working back home in Africa, I was lucky enough to train as a general nurse, which meant that my training involved going and experiencing all sectors or most sectors that you can work in as a nurse. So during my training, I did gyne and obstetrics. As I sit here, I have delivered more than 50 to 100 babies. As I sit here, I've worked in pediatrics. I know about immunization schedules. I know about childhood diseases and all of that. I was also trained in mental health. I did secondment, attachment in a mental health hospital where I saw most mental conditions from depression to schizophrenia. So as a general nurse, I was lucky enough to experience and be taught how to be a nurse, a versatile nurse in many, many environments. And after I finished my general nurse training, my first station was I was an outpatients department nurse, which meant that I was actually doing consultation, which is something that is very different from how they do things over here. Because over here, nurses mostly have a subordinate role to doctors. But where I'm from, you are empowered to work in outpatients and actually get to sit across a patient and you talk to them. And if it's something that according to your abilities and training you can treat, you can go ahead and prescribe medication, prescribe treatment, and the person will come to the hospital, will come to your hospital, talk to you, you prescribe the medication, they come for a review. If they feel much better, you know you've done the right thing. If they don't feel better, you can actually escalate it and send them off to have a doctor look into it and maybe get them the help that they need. So I worked in outpatients department, and honestly, that was the most fulfilling role I have ever performed, because it was so empowering just to sit across a patient, to have them explain their history, to take the time to take that history and to use my critical thinking skills that I was trained, as a general nurse, to get to the bottom of it and give the treatment that they need. And actually, more often than not, the treatment that I would give was sufficient. It was able to give them the relief that they needed, and it was able to treat the conditions that they presented with. Of course, there were conditions that would come to me and they were above me. I couldn't really help, and I was humble enough to transfer them to see a doctor. And sometimes the general practitioner who would see them would actually say, well, that is also above me, and send them to a specialist and they would get the treatment that they need. So after working in outpatient department, I was attached to the pediatrics department. I worked there for a couple of months actually. And as I was working in the pediatrics department, I also worked as an EMT. That is one of those guys you see in the ambulance, first responders. And again, it was a very fulfilling experience, because I got to attend emergencies, provide first aid, first contact care. And I'm happy to say that when I was in that role, I performed really well. I managed to help people. I managed to save lives. It was a lovely experience. I also worked in a medical ward. I worked in a medical ward for maybe 1 or 2 months. I didn't like it as much because it was mostly following orders, because if someone presents with a medical condition, once you get them in the ward, they already have a treatment plan in place and all you do is implement that plan. So for me, it wasn't a good experience, because I like to find out, I like to explore, I like to investigate. So it wasn't a good fit for me. So after that, I had to move into surgical, which I found to be a wonderful and rewarding experience, because after a person has gone to surgery, when they come back to you, you have to treat a lot of things. You have to treat emergencies, you have to look into their pain and be able to relieve that. And you also have to do checks after the operation to see if it was successful and to see if the desired effect has been achieved. So that's just a baseline of what I did back home and how I found many fields to be rewarding as a general nurse. So after working for about 3 years post qualification, I decided I have to take my talents to another place, because I wasn't getting the remuneration that I thought at the time I deserved. So I was like, yeah, let me move to Europe. And as I was applying for jobs in Europe, I had many options. They had openings for medical, they had openings for surgical, they had openings for mental health, that is care home or young adults with learning disabilities. Ultimately, I chose to go into surgical because, as I've said, it was one of the most rewarding experiences in my training, with the most rewarding experience being outpatients department. But here in the Western country where I work in, they don't have nurses who actually consult and prescribe. So I had to choose my second favorite placement, which was surgical. So if you are to work in a surgical area, it's a very fast-paced environment. And you see it like on the job advertisement, they'll say, are you willing, are you able to work in a fast-paced environment? What that simply means is you are going to be busy. You're going to be on your feet throughout the day. The most number of patients I've had is 6, which might not sound as much, but imagine as a surgical nurse, you have 6 patients, and you could have 4 of them have had hip replacements and 2 of them have had knee replacements. And after surgery, the effect of anesthetic medication is different for most people. You can have one person who presents with MSs. Just being put under general anesthetic makes them sick, makes them vomit and vomit and vomit. And for someone, it can be pain. After undergoing general anesthetic, they come back to the ward, and as soon as that anesthetic is out of their system, they are in so much pain, and you have to treat the pain. And for some, the complication would be, this is quite rare, but it happens, bleeding. And when someone bleeds after surgery, you have to use your discretion and your skill as a nurse to determine how you deal with it. So the first line is, if someone is bleeding, you can redo the dressing. If the bleeding continues, you can use steri strips to try and approximate the wound edges closer together. If that doesn't work, you may have to use the steri strips and the pressure bandage. If that doesn't work, you just might have to call the RMO so that they can have a look and see if there's a vein, a vessel open that is causing the bleeding that needs surgical attention. So if you're working in a surgical environment, it's fast-paced. In the morning, you get your patients, you send them off to theater one by one, and even before the last patient goes into surgery, your first patient is coming back. And when they come back, you have to do all those observations, quarter hourly, half hourly, hourly, 2 hourly, depending on the condition. So it's a very fast-paced, busy environment. You will be on your feet all day, those 12 hours. But surprisingly, the remuneration, the money, the pay that you get in working in the surgical area is, I think, just the basic salary you'll get as a nurse. Okay, because when you start, they don't care if where you come from, you were a nurse manager or whatever. When you come here, they start you off at the lowest level. So if you're someone who likes putting their nursing skills to work, who enjoys using all the things that you learned in school in practice every day, if you are open to dealing with challenging situations, surgical nursing will be for you, because there's never a dull moment in surgical nursing. Because oftentimes, even like, you have to put off going on break because something is happening at any moment. Something is always happening at any moment. It's busy. But the money is not as good. So I worked in surgical for like a year and a half. It was a very good experience. It was very busy. And after that, I moved to go to work in a mental health setting, to work in a care home. So the thing is, if you work in a care home, in the UK at least, you get paid a bit more, because you have the whole unit or ward to yourself as a nurse. And you have your healthcare assistants who are called nurse aides where I'm from, helping you to do the work, but you'll be the manager, you'll be running the unit, you'll be responsible for all procedures, from simple procedures like dressing, catheterization, to whatever procedure that may be necessary on your unit. You'll be responsible for looking after the staff, managing the staff, and you can have anywhere from as little as 10, they don't call them patients, but residents, from as little as 10 residents to as many as 20 residents who present with different conditions. So in room 1, you might have someone who's bedbound, who's living with dementia, but also their swallowing reflex is gone. So they are on modified food and modified liquids, thickened liquids. In room 2, you might have someone with maybe who's catheterized and who is paralyzed, and his GIT system is not working so well and has to pass his waste through a bag. So you will have a colostomy, a catheter in room 2, and someone on modified food in room 1. And in room 3, you might have someone who's dealing with a totally different condition. It's like being the only nurse in a ward with 10 to 20 patients. And being in a mental health setting, it's quite taxing because you have to do all the nursing duties that come, and also you are responsible for everything. So if there's something going on, from something as simple as a bed that's not working properly to someone who has fallen off their bed, you are responsible. To doing care plans, you are responsible. Giving medication, you are responsible. So there's quite a lot to do if you are working in a care home in a mental health situation. And as a result, the money is a little bit more, a lot more than you get in a surgical environment. So when I was working in a surgical environment, I was making X pounds an hour. When I moved into the mental health setting, into the nursing home, I was making 2x. So I was making double what I was making in a surgical setting. But for me, it was not just about the money. For me, it was about the career progression. So if you work in a surgical setting, most likely you'll find way more senior nurses than you who are already working there, and it will take you at least 5 years to get into a position of management, wherein you'll be able to make more money. But if you go into a care home and you are good at a job, you are confident that you can take in more tasks, the career projection is a bit faster. Not only is the career projection a bit faster, you get more basic salary just as a nurse than you would get in a surgical environment. So for anyone who's thinking, just have this in mind. I just make this video just to try and, give you an idea of what it's like. For me, I enjoyed working in surgical, but for those two reasons, making more money, progressing as a nurse, I chose to go into the care home, and it's been quite a rewarding experience. I have progressed so fast from just being a general nurse. It's called band 5 here, which is like the lowest band you can start off as a nurse. Right now, I'm now a nurse manager. I'm now band 7. It's something that would have taken me years to achieve if I was in the surgical or medical area. And who knows what life will bring in the next year. I might even move even further. So as you make your decision, you might be still back home thinking, which area should I go into? If it's about making more money, career projection, and progression, definitely I would go the mental health route. I would go the nursing home, adult care, learning difficulties role, because you can progress in your career really fast if you are competent. If you like getting your hands to work, if you enjoy a fast-paced environment, then the surgical or medical area is for you. So I hope this video makes it easier as you make your choice. Either you are thinking what to do, or you are thinking, should I change? This video will help you make that decision. So thank you for watching. If you have any questions, or you have a video that you'd want me to make, just share in the comments, and I'll use my experience to, talk you through it, give you some advice, share my experiences as someone who's been working in the diaspora for quite a while. Thank you for watching. Like, share, and subscribe. Cheers.